From ABC News, the weekly journal of health and medicine. This is The Health Show.
Another potential threat to our lungs, especially at this time of year, is pneumonia. In this decade, the death rate from pneumonia has been steadily climbing. For a relatively common condition, it's widely misunderstood. Jackie Judd has some facts.
Well, the song has it half right. There is no rockin' pneumonia, but pneumonia is a potentially serious infection, expected to strike nearly 2 million Americans this year. Almost 67,000 people died from the disease back in 1986. Pneumonia usually targets people with weakened immune systems like the elderly, pulmonary or heart patients, and people with other chronic illnesses. Adults between the ages of 25 and 40 often contract so-called walking pneumonia, an infection picked up by normally healthy people, characterized by a persistent cough. Although medical treatment is recommended, people generally don't feel so sick that they can't walk around. No matter what the strain, the method of infection is usually the same.
Other people cough, have it in their sputum, and you inhale that. It gets into your own nose, throat, and then down into your lungs. So by and large, it's airborne transmission.
Symptoms of pneumonia can include high fever, cough with or without sputum, chest pain, headache, and sometimes nausea and muscle ache. The impaired immune system permits bacteria or viruses to invade the normally sterile lungs. These organisms then multiply, causing lung tissue to become inflamed. Breathing can become difficult. If the influenza virus enters the lungs, it can spread much more quickly, damaging the air passages and leaving them more susceptible to new bacterial infections.
So if you were to prevent flu, you'd more likely prevent all types of pneumonia.
Treatment for pneumonia depends on the cause of the infection. Bacterial or pneumococcal is usually treated with antibiotics. Antiviral drugs such as amantadine can be used to fight influenza, even before it turns into pneumonia. More serious cases can require a hospital stay of a week to 10 days. The good news is that there are vaccinations for both influenza and pneumonia. Doctors recommend yearly flu shots for the elderly and other susceptible groups. And there is an inexpensive one-time vaccination which provides lifelong immunity against most forms of bacterial pneumonia. Doctors are confident about the safety of both vaccines.
The pneumonia vaccine that we have right now ought to be given to everybody 65 or older.
I've been really impressed with how asymptomatic people are after getting the vaccine. And if it means anything to you, I'm under 65 and I took the pneumonia vaccine when it first became available.
And if people would practice a little prevention in the form of vaccinations, they could rock through the winter without the threat of pneumonia. This is Jackie Judd for The Health Show in Washington.
Since flu and pneumonia symptoms are so similar, it's difficult for patients to tell the difference. That's why experts recommend, to be on the safe side, see a doctor. For more information, contact your local American Lung Association.
This has been a presentation of ABC News, where more Americans get their news than from any other source.